I'd like to welcome all of you to this presentation, which I know I've been looking forward to because I spray myself every time I go outside now, but and I'm sure we're going to learn a lot. I want to first thank and welcome you from the Springfield Town Library, who's sponsoring this event, and the Friends of the Springfield Town Library, who are also sponsoring. Dr. Chesney is, she has a master's, she's a doctor, a naturopathic doctor, and is a licensed acupuncturist. She studied in Connecticut, where this all began, and I've heard from many people that she really knows what she's talking about, and a lot of people go to her because she's so good at this. So I'm not going to talk anymore, and here she is. Thank you.
Well, thank you, Bonnie. It's very kind of you. Thank you for having me. So I'm Alexis Chesney. I work at Sojourn's Community Health Clinic in Westminster, and came up this way, beautiful drive. It's nice we have some beautiful weather and all the leaves are out. So that's when the ticks come out, of course. So let's dive right into that. So today we're going to be focused on Lyme and tick-borne diseases, prevention, diagnosis, and treatment. So first we start with this sort of overwhelming slide, unfortunately. This is, are you having trouble hearing?
A little bit.
Okay, I'll try and project.
Is the microphone working?
It's not a mic, it's just being.
Oh, okay.
Okay. Yeah.
And is the lighting okay for everyone, we think? Okay. So this is the slide showing possible symptoms for Lyme and tick-borne disease. There are many symptoms up here. Of course, if you have one of these symptoms, it does not necessarily mean you have Lyme disease. It's here to show just how complicated it is to experience Lyme disease, diagnose, and treat, because these are some of the symptoms that people can experience with Lyme disease. So let's go over a little history. In 1975, Dr. Alan Steer discovered that a lot of kids were having juvenile arthritis, or so he thought. He thought it was an autoimmune disease that was causing these joint pains and swelling in kids in Lyme, Connecticut, in that area. Around the same time, across the Sound in Long Island, Dr. Burrascano was also seeing a lot of kids with these sorts of symptoms too. And we'll come back to him later. So Willy Bergdorfer, in 1981, finally was able to identify the pathogen later named after him, Borrelia burgdorferi, in ticks discovered in Long Island. And that is the known cause of Lyme disease. So here we look at some maps. So this is 2012. So it shows all the blue dots are looking at where the cases of Lyme are in the country. And then we're going to move ahead. 2017, we see how dark, especially this northeast, is getting. So incidence by state. I like to look at this since I arrived in 2010. Vermont has definitely crept up into first place a couple of times and now holding at second place in the nation for incidence in Lyme disease. We see that New Hampshire and Maine, especially right now, you know, these three states up in New England have really seen a lot more Lyme in the last 10 years. And so here's a look at our state. So this is from 2017, the latest numbers that we have. And when you look at this map, the darker the green, the more cases of Lyme disease in Vermont. So going back to 2016, when they made a note about incidence of Babesia, we haven't heard too much about tracking that since. But in 2016, they were really showing that there is a rise in babesiosis, which is a protozoa, a different type of pathogen that's carried by ticks. We will talk about this a little later. And they also showed that anaplasma has been increasing in this area too. So those are the top pathogens that deer ticks carry in Vermont is Lyme, Babesia, and Anaplasma. So we'll come back to that later. Now this word incidence, it's tracking. Basically, we're looking at surveillance. The CDC really tracks the number of reported cases, but not every case of Lyme is actually reported to the CDC. So they admit that actually probably only 10% of cases are reported. So that means 300,000 new cases of Lyme are happening. And that was back in 2013. Another study came out around that time, which actually boosts up the numbers to maybe something like 12 million cases a year. So this chart looks at different tick-borne diseases. So I thought it was interesting. We're not going to get into all of these, but this gives quite a survey around the country with all the different ticks that we have in the United States. So we're really looking at these top three. Those are the types of pathogens that the deer tick carries. And this is all the latest numbers, so not everything is updated, but as the numbers roll in, I update this chart, and it just gives you an idea of which tick-borne diseases are more prevalent than others. So this is our deer tick. Of course, anyone seen one lately outside? Yeah, so they're out, definitely. So this is also called the black-legged tick. Ticks are actually arachnids, not insects. And so this is our vector. So this is the organism that is transmitting things like Lyme, Anaplasma, and Babesia that we'll be talking about. I like to compare to the American dog tick. So these are also common in this area. And luckily, these do not carry pathogens, at least in Vermont. When you go outside, especially southern, like the Atlantic states, they do carry pathogens, so be careful down there. But generally, I don't worry when people have a dog tick bite. So it's important to be able to identify the ticks. And so the way to identify is looking at this part. We're going to go to this slide and find that. So this is called the dorsal shield, and that is the way to properly identify a tick, especially after it's been feeding, because it will get distorted as it gets engorged. So it's harder to identify this part of the tick if it has had a blood meal. Of course, this is a great way to identify the adult female deer tick because it's got that little red kind of tan catching the eye. But this is an adult, and the nymphs, which are smaller, do not have that reddish back. So it's really important to look at this part. So this part is black, and that's the scutum or the dorsal shield. So that's the best way. That's the closest to the head. I'm going to pass around this helpful picture so you can see it up close if you want to pass it around. Thanks. So on that picture, I circled the dorsal shield so you can really compare. And so this, of course, looks a little different. It's more mottled. It's not uniform in color. It's a little grayish, brownish. They are also bigger, but I don't like to focus on size because I have had many people come in and say, oh, it's fine, it's a dog tick, it's too big. They bring it in and it's actually an engorged deer tick, and it's large because it actually fed on somebody. So the best way to identify is definitely comparing these two areas. So let's talk about the tick life cycle. So they have a 2-year life cycle. They start with eggs being laid in the spring, and then they develop into larvae, which is the smallest stage of the tick. And they usually will attach to a smaller animal, so something like a mouse or a bird. They don't move very far, so they're probably in leaf litter, something like that, not going too far. Although I've had, unfortunately, some kids with some larvae bites because kids get into those areas. They might be rolling around in the leaves or something like that. Usually an adult person doesn't come in with a larvae attached. So they'll have their blood meal on a small animal and then grow an extra pair of legs, making them a nymph, the second stage. A little bigger, but still hard to see. And then they will find somebody else after they winter over, and maybe someone a little larger. So certainly a human or dog or something like that, attach for another blood meal, and then they will become adults. And then again, the females, more so than the males, need to attach for a full blood meal, which was the little tan back that you're going to see on the deer tick. That's the female. So she needs a full blood meal so that she can lay some eggs. And so then the whole cycle starts again. So there's certainly overlap. It's not a perfect 2-year cycle like that, but there's a general trend in who you're seeing out there. So of course we have the bookends of the adults in March, April, May, depending on where you live, how cold it is, and then October, November, December. And certainly it can go into the colder months that these adults and even the other stages of ticks are out. So some people think, there's snow on the ground, or it's January or February, we can't possibly see ticks. And I've certainly had people come in with tick bites, so I can't warn you enough that it is possible. We have a really nice day somewhere in the winter, and it only takes 28 degrees Fahrenheit for a tick to be active. So they could certainly come out if you're out there, where they are. So just to be careful around that. But we are now May going into June. So June is going to be the nymph season. Those are the ones that are harder to see. So definitely keep your eye out. Do your tick checks. So June and July we'll see those smaller nymphs, and they're all black, so they don't have a little tan back to help you out. And then actually we usually get somewhat of a break. There are certainly less adults and nymphs in August and September. So people forget, they think, oh, the ticks are gone, everything's great, and then comes October where the adults are out again. So just not to forget and to continue doing your tick checks throughout the summer, because there still might be some adults and nymphs out there. So this is how small the nymph is, 2 little dots there. And that's on a finger. So I have my next handy tool that I got very excited about. This is what I get excited about. So this is Find the Tick. So these are not bagels. I'm not a big proponent of eating bagels, but they're fake bagels. And so the size of a poppy seed is just how big a nymph tick is. So you can look. There are 3. If you wanted to start, there's a little magnifying glass. If you wanted to play this game, if you don't, you could just pass it down. There are 3 ticks. They're dead. Don't worry. So you can identify. You can feel free to take the bagel out. The poppy seeds are falling off a little bit, so just be gentle. But there are 3 ticks, so see if you can really find it. I think it's really important to train our eye to identify these ticks because they are small.
She said dead.
And so here's another way to look at the sizing. And then just looking at the engorged tick. So of course that's much bigger. And how do we identify, right? We go over here close to the mouth parts. That part is black, so that tells us it's a deer tick. So this slide is talking about Lyme transmission. We've reviewed this a little bit, so I'm going to move on. I like to speak about birds for a little bit because of the migration pattern and how that has contributed to the spread of Lyme disease and other tick-borne disease. So we see here some nicely engorged ticks on the poor bird's eyes. And so, this northern corridor, northeast corridor, and then also the other side of the country where California and Washington and Oregon are, there's quite a spread of Lyme on these 2 coasts, and it's really bringing it up into Canada at this point too. All of the southern provinces of Canada have seen deer ticks, and there are a lot of cases of Lyme up there now. So we talked about what the ticks can carry, but do all ticks carry Lyme? No, not all of them do. And for now, for the purposes of when I say tick, I'm talking about deer ticks. So for the rest of the talk, we'll really be focused on deer ticks because we're in Vermont, and that's what we're concerned about. So Vermont's actually doing this tick surveillance program, which is awesome. So since 2015, they've been gathering data, and we have a lot of the information. They're testing for a lot of different pathogens. We don't see as much powassan or Borrelia miyamotoi, but they can be carried by deer ticks as well. So here are some of the results, which are great to share. So just thinking about how many deer ticks in this area carry Borrelia burgdorferi, which is Lyme. So it's a lot, 46 to 58%. So it varies on the region. If you wanted to look this up, you can find it online. It's really interesting. Every year they test different sites. It seems somewhat random, but it depends on the areas. There are some areas where 80% of the ticks were carrying Lyme and some 20%. So there's quite a range. So some people, we see that, certain areas that patients come in from, I see, wow, there's a lot of Lyme in, Rutland, or there's a lot of Lyme in this, county and such. And so I think that's partially due because of this infection rate, that there are some areas that have higher infection rates. And you can certainly see, we do have powassan in this area, but it's pretty small, and Babesia spans quite a lot. All very important to think about. Sometimes I do a video. I don't think today we have access. That's okay. You can go to tickencounter.org, which is a wonderful website, and I highly recommend it anyway. You can see lots of pictures of ticks. You can find some of the information that I am talking about today. And also they have a little video that is also helpful in training the eye to look for ticks, because they are small and they do crawl up. So if you were to, step on some grass and then the tick is questing, which is reaching out for someone to attach to, and the tick attached to your foot, it would start crawling upwards. And so this video just shows how that happens and how fast they really can be. And so they'll keep going up until they find a nice warm spot to attach to. So let's talk about Lyme disease. So this, of course, is the most common vector-borne illness in the United States. It's a spirochete. It's a very particular type of bacteria that's very unusual and hard to treat. This spiraling nature is part of why it can get into tissues and be hard to get them out of certain tissues and joints. It has characteristics of parasites, which make it really interesting as well. So here's our spirochete. And then it's really important to know that this guy hides in different ways. So they're very tricky in that they can change forms. So they can lose their cell walls. They can also change into a cyst form. So they kind of ball up into that cyst. And then another thing that they do is they create biofilm around themselves. So you've got all these little spirochetes, and then they create this little house, this little shell that helps them hide from the immune system. There are studies showing, for instance, doxycycline pushes the spirochete form into the cyst form. Of course, it kills some of the spirochetes too, but this can lead to persistence. This idea of why do some people continue to have Lyme after a certain course of antibiotics. This is a huge piece in that, because they're hiding in these different ways, and doxycycline does not kill the cyst form. It does not break through biofilm, so it's really important to address that during treatment. There are also co-infections, which make it complicated. So we covered a little bit about Babesia and Anaplasma, but look at this long list. So there's quite a long list, depending on what tick we're talking about, that they can carry and transmit to us. So the one thing I would love for you to go home with, if you don't already do it, is please do tick checks every night. Unless you are completely away from any greenery, even your yard, you can get a tick bite from walking on very short grass. So please do tick checks. We'll come back to that. Prevention, so thinking about ways in which to prevent getting tick bites is huge. So in addition to that tick check, think about using tick repellents. So this is a wonderful tick repellent that we have at Sojourn, Cedar Side Tick Shield. It's cedar essential oil and has been studied. It does very well at repelling or killing ticks. I do recommend applying it more often than something like DEET. So of course DEET works and you can use DEET. If you use this, I would apply every 1 to 2 hours because it loses its potency. And it's safe for pets, so over 15 pounds, so mostly dogs. So yeah, it's been great. I've used it on dogs and I know a lot of people that do, and it seems to be effective in addition to whatever treatment you might be giving your pet.
If you do use it in a mass area, check that no one's allergic to cedar. We were in Costa Rica and used it on a boat ride. And all of a sudden someone started touching their eyes. I said, did you get it on your eyes? And they said, no, I'm allergic to cedar. I said, do you have your EpiPen? She says, I didn't think I needed it on a boat ride. So that made me very aware. I never even knew people were allergic to cedar. But she had an instant reaction with us just spraying it. I was spraying it on my hat.
Okay. Thank you. Yeah. So permethrin is another option. I like to use a tick repellent and think about using permethrin in certain ways in combination. So permethrin is toxic when wet. So if you use it to apply to your shoes or your clothing, please wear gloves or be careful with that. It is, just as a side note, it is used in scabies treatment. So clearly there are medical reasons why people would put this all over their body. So it's not fatal to get it on you, right? But it's best not to do that unless you needed to. It was really interesting. There are some studies out there with permethrin that are just amazing. And so there's this one showing just treating sneakers and socks decreased your chance for a tick bite by 73 times. It's huge. So what I do is every 6 weeks during tick season, which is basically possibly all year long, depending on the weather, you put the shoes out, sneakers, boots, whatever you want, spray them down, let them sit and dry for an hour or so. It should be dry. When dried, this is safe to touch for us. That's fine. But it's still toxic to ticks. There's a wonderful how-to video, again, tickencounter.org, which is wonderful. So it can show you how to do this safely. Yes?
When you spray it, it lasts only for 6 washings.
Yes, yeah. Well, 6 washings or 6 weeks, yeah.
Whichever comes first.
Okay, thanks. So put it on your calendar and then you can make sure to do that. And the other thing you can do is send your clothes away to Insect Shield. So when they treat it in the commercial way that embeds it into the clothing, it lasts 70 washes, a long time. So a combination of treating your own shoes, maybe your own socks, sending some clothing to them, or buying clothes that already have it embedded in clothing. There are a lot of options out there. Sam's carries these types of clothing. And then also using tick repellents, especially for our skin. So another option for prevention is using something called tick bite formula. So this is something I designed for treating tick bites, but also thinking about high-risk populations, like farmers or loggers or people that are just out there all the time where the ticks are. So in addition to doing all the preventative measures, you could also take tick bite formula as a prophylaxis. So some people choose to do this while they're doing the activities outside that put them at risk. There are certainly, we're going to actually go into all of these herbs, and I have an ebook that goes into any drug interactions and side effects, etc., which we might not completely cover today, but that's all in the ebook. So if you were interested in that, you could read more about that. So the other favorite down here is about the diet, right? No sugar, yeast, and alcohol. Everyone wants to sign up for that. So that's another way of being extremely preventative, just thinking about what the food is for Lyme. And if you really wanted to make sure that you had something in your system that would affect your immune system in a way that would be unfavorable to Lyme and kill Lyme, in addition to not feeding it if you were exposed, then you could also add the diet piece. Yes?
Can you take that formula while you're being treated for, say, while you're on an antibiotic?
Yeah, I use these herbs a lot with antibiotics as well. Mhm. So other things to think about regarding prevention. So think about where the ticks live and avoiding those areas or being very careful in those areas. So things like wood piles and stone walls and all the damp, moist, dark areas is where ticks love to be. Also thinking about eliminating tick habitat. So thinking about decreasing your exposure to those areas, raking up leaves, cleaning up wood piles, and thinking about deer and mice as tick carriers, and trying to eliminate those from your immediate area. Also, there are perimeter sprays. So these are some of the natural options. Some people use permethrin and other pyrethrins, but they can be hard on the insect population in general, in addition to arachnids, and then also to fish and other animals. So I would be careful with using that out on the land. These are some studied possibilities that use essential oils. So tick tubes. This is looking at the mouse population and targeting them. So those larvae often will attach to a mouse, or even the nymphs that are smaller. So thinking about really intervening at that stage before they can get their blood meal, where they get Lyme, and then continue to grow and attach possibly to you at a later stage. Really targeting mice is excellent. Actually using tick tubes decreases the population by 93%. So what are tick tubes, right? So you can actually make your own. You can buy them online. You could go to tictubes.com or Thermacell, or you could make them yourself. So if you save something like paper towel roll holders, and then you could save lint or get cotton balls, something like that, and then treat the lint or cotton balls with permethrin safely. Let that dry, put it into the tubes, and then put that out in tick and mouse habitat. So on tictubes.com, they actually give you how many you need per acre, so you know how to get this efficacy rate. So you can actually do that on your own property. And I've had people come back from one year to the next saying just how many ticks are inundating their family. There's so many in their yard. And then they do the tick tubes the next year, they come back and they're not seeing any. So it's been really great that way to get that feedback. It can be very effective. So the idea is, so they're bringing this permethrin covered cotton to the nests, and then that is going against the ticks that the mice are carrying. And so it'll kill the ticks on the mice. Yes?
How long will the tubes last outdoors?
Yeah, I would recommend putting them out the 3 seasons, like spring, summer, and fall. And you can check them. That's what they recommend. Like it'll last a few months, and of course they can get damaged by the weather. So checking on them in a couple months is a good idea if you want to stay active with it. Yeah. There was a question back there, I think.
Does it hurt the mice?
Apparently it does not. Yeah.
That's too bad.
I know. Good. Pros and cons, I don't know. Oh, my little clicker is not working, so let me just check this out. Okay. So on the topic of pets, you can treat your outdoor pets. I'm not a veterinarian, so I'm just sharing this information as something to ask your vet about or to research as an offering to think about how, of course, our dogs can get Lyme themselves, but also bring the ticks into us, and then we could, unfortunately, get a tick bite from them. It looks like there's something popping up about a website here. So, I think it's just going to keep popping up. We'll give it one more try, and I might have to do something else. So let's talk about the tick bite. So less than half of the population with Lyme remember a tick bite. What to do after a tick bite. So you have your handouts. The handouts are really talking about prevention, and then this part of the talk about what to do after a tick bite. So, of course, remove and identify the tick. Try and look for that dorsal shield and find out what kind of tick is this. Do I need to be concerned about this or not? Apply first aid. Think about sending the tick for testing. Begin an herbal treatment, and watch for symptoms. So first we have the removal. Now, I actually don't recommend the tweezers. It's often very messy. I recommend this tick twister. If you wanted to pass that around, you could take it out and such. They work very well. That's what I use. And it really gets right under there, and you just twist it up. There's a picture. And so, actually the mouth parts have this particular way of going into the skin that is a spiraling motion. So it actually, the twisting it out makes a lot of sense in that way. So this is an engorged tick, and you can see how that works. Now there are a lot of different tools out there. People often do well with the flat sort of spoons. I forget the silver ones. That usually works pretty well. But the tweezers, I'd just be careful, because agitating the tick is not a good thing. So I would not add petroleum or burn the tick, or do anything that's going to try and get the tick to back out, because as it's doing that, or as you're taking time and moving it around, it might regurgitate back more of whatever pathogens are in its saliva.
What about just your fingernails?
Yeah, I mean the squeezing, usually that's hard to do without squeezing the tick. So I wouldn't recommend that either, because you could squeeze the tick.
I usually find them on me in the shower, and I just grab them off.
Yeah, so maybe having a tool in the bathroom would be good.
I do, but I want to get out of the shower, so I put it in the shower. Okay? So it's better to actually use your twister.
Yeah, and then you can save it. You make sure to get the mouth parts out that way, which is a good thing. It's not necessary, but it's a good thing. Yeah, I don't know. I mean, maybe you have a technique where you're not squeezing it, but I just would be concerned about squeezing the body of the tick. Using fingers.
I just get angry. I just see this tick and I want to get it off.
Yeah.
And I have to laugh, because I sent one away for $50. And the next day or so, I get another one, and then it's like, that one I got so angry, I just threw it down the drain, and they went, that was silly. And so anyhow, yeah, okay.
And then after the tick bite, you can put andrographis on it, because that's actually I use that to kill Lyme if you take it orally. So if you put it on your skin, it could get to any Lyme that may have been released by the tick. Unfortunately, this isn't a lovely image, but the tick releases feces on the skin, and those feces can contain the pathogens. So if that happened, and then some people feel really itchy, and they're itching their bite, and it's inflamed, and that could be moving the feces and the pathogens into that wound. So. And also, I've gotten some good feedback just about it being less inflamed and less itchy if people apply this andrographis after the bite. So you can also use tick bite formula. We have that. I talked about that earlier. You could, if you don't have those things, you could try Neosporin or alcohol. But andrographis is specific to Lyme, whereas Neosporin and alcohol aren't. Yes. Well, we have this at Sojourns. You can also find it like a co-op. Usually they have Andrographis. Yeah, and we sell just really small bottles of that so that hopefully you won't be using much, you know, so you can use a little drop, a couple drops on the bite. But after this, no one's going to get any tick bites, right?
I've had 9 this month already.
Oh my gosh. So another question that comes up is how long does it take for a tick to transmit Lyme, right? People often ask, well, how long was the tick on? If it's not on for 48 hours or 72 hours, you're fine. But there's really this main study, and there are a few others, but this main study looked at 6 to 72 hours. They didn't look at before 6 hours. So there's basically like a bell curve. You know, yes, it's more common and it's more likely to happen if it's more like 24 or 48 hours, but it can certainly happen at 6 hours, it was shown. It can happen later, it could be longer before it happens. And I wonder, well, what about before 6 hours? I would like to know if that's possible. And then I always ask people, well, if you knew exactly when it attached, would you let it attach? So that's also, you know, yes?
I'm assuming you're familiar with, I think it's Stephen Bonner.
Buhner, yep.
Didn't he say that as soon as it's actually spit the glue that holds it, the tick to you, that's my non-scientific version, that it actually, that even at that point, because it's transmitted, fluids can at that point transmit it.
It can, absolutely.
So as soon as it
It's possible, yeah. But it's sort of like, when does the tick feel it's ready? You know, we don't know that answer. It would be nice if we knew that answer. Yeah.
Every tick is different.
So here's something. Oh, there's a question back there.
I'm sorry, if you had a tick and if you believe that it might have been on for an extended period of time, perhaps because of its size or something, is it valuable to save the tick? And if so, how?
Yes, we're going to talk about that. Save the tick, and you can send it to get tested. Yes.
I think you find it probably is a lot more people that have Lyme disease, simply because conventional medicine hasn't come up to speed very well. Unfortunately, through personal experience, I can tell you that most urgent cares will say 72 hours. And when in fact, you know, it's way sooner than that.
Yeah.
But that's what everybody's being told, and just kind of brushed off as, well, you can have it on for 72 hours, so you must be fine. And in fact, that's really not the case.
Yeah, that is the norm out there. Yep.
Yeah.
So what to do after a tick bite? So you've put your Andrographis on, you've saved the tick. You could take Lidum, which is a homeopathic. So this doesn't replace any further treatment, but it's going to help your immune system start working in a way that helps you deal with Lyme if it was transmitted. So you could choose to do that. You could have it in a little first aid kit with your tick twister and your Andrographis, and then just start doing this immediately. And so now we'll talk about the Erythema Migrans. So this is also something that doesn't always happen. So less than half of people remember this bullseye rash or Erythema Migrans, which doesn't have to look like a perfect bullseye after a tick bite. What happens is, you know, sometimes it does look like a bullseye, or it's basically erythema, which is redness of the skin, inflammation. It's the actual Lyme itself causing this in the skin. It's a skin infection. And so there are a lot of different ways it can look. The migrans part means that it's migrating outward. So it can spread, and sometimes it's hard to see. The lighting's a little hard too, but basically the outer borders on this person's back, shoulder, is there, and then you do have a little bit of a bullseye look to it. But if you're living alone and you don't look at your back, you know, you may not find that. Yes?
Your last slide said it can get to 70 centimeters?
Yeah.
2 feet, 3 inches?
Yeah.
Okay.
Yeah, it can spread all up and down the body, yeah. And so here it's around this child's neck, and this was cultured. We know that this was an actual Lyme infection. So that, you know, that could look like a lot of different things. Who knows? So it's hard sometimes to know what kind of rash is this. So, of course, was there a tick bite there? Is it around a tick bite? There's also a disseminated rash that can happen, multiple bullseyes or multiple rashes throughout the body. That's another way that it shows up. And then those also grow in size. And then as you get treated, in any way it would resolve on its own. If you weren't treated, it goes down in size.
Excuse me, how long
Yes.
does the rash last for?
Usually around a week, maybe 10 days. Usually people get treated though, so it's shorter if you get treated.
Well, I had one bite that really got hot and big. It wasn't a bullseye at all. And it only, because it's so itchy. Because I think I'm extremely allergic to the bite. And it was a place it was on thigh, and so it's constantly rubbing. And, but it's only like the first couple of days, and then it disappears. So I was just curious how long that.
Yeah, so the rash doesn't have to be the bullseye, but the criteria is really that it's more than 2 inches in diameter. So of course there's the itchiness, and that can be creating redness, so deciphering what's what can be hard, but that's another way to look at it, the 2-inch mark. So Apis is another homeopathic that you could take if you had this rash. You could take Ledum and Apis. And of course, again, this doesn't replace proper treatment, but if you're at home, you have your little first aid kit, you can get this started before further treatment. And then there's deer tick bite formula. So starting an herbal formula that goes after each of the pathogens that deer ticks can carry in this area is another option. So these are the list of herbs that are in there. Cat's claw and knotweed get to Lyme, cryptolepis gets to Babesia, and Houtunia to Anaplasma. And someone mentioned Stephen Buhner earlier. So these are herbs that he speaks about. He's compiled a lot of literature. He's an amazing researcher and herbalist. So he has a book called Healing Lyme, if anyone's interested in that. You can read all about these herbs. It's wonderful. In addition to that, I would recommend serapeptase. So that is a biofilm buster. So earlier we saw that slide of that shell with all the spirochetes inside. So this serapeptase breaks through the biofilm, exposing the pathogens to the other herbs. So this is something that one could start on their own or after they see a practitioner. Like this is something I recommend for people for 30 days after a tick bite. When you don't know, you just had the tick bite. We don't know yet if it transmitted anything. Maybe you didn't save the tick, so we're not going to be able to test it. So you could do this as a prophylactic treatment for 30 days. And of course, if symptoms develop, then we're moving into a possible different phase of treating an actual known disease, and that would be a different type of a treatment. Yes?
Is this safe for children?
Yeah, it does not taste very good. So the cryptolepis is extremely bitter.
Tastes awful.
So with kids, I often use a different protocol, which is on the sheet. So they're a little gentler in taste. And of course, it's all by weight. So the adult doses are on the paper, and you would just adjust by weight of the child.
I have a quick question.
Yeah.
Serapeptase. Once it breaks the biofilm and the pathogens are released, where do they go?
So the pathogens are released, and then you have your deer tick bite formula herbs that would kill the actual spirochetes and the cysts.
But the biofilm is broken, do they enter the bloodstream or remain sort of in the area where they were? Obviously, I would think it happens through the bloodstream because the antibiotic proceeds that way.
Yeah, and in tissues that have vascularity that brings the blood to the tissues, so we would get to those areas as well.
So can they regroup after the biofilm is broken, and those that escape those that escape the antibiotic, can they regroup?
I mean, sure. I don't know that the treatment, the first dose, you're not going to be getting to all of it. This is going to be
So it's
in motion, of course, yeah.
breaking the biofilm, taking the antibiotic to kill the pathogens, breaking the biofilm again. Is that
Yeah, yeah. So over time, I think, you know, it wouldn't happen all at once that we open a biofilm and we kill all of the spirochetes inside. I don't know that that would happen. We don't have any studies whether or not it does, but I think over time it would be happening.
Pathogens reproduce in the body.
Mm-hmm.
I mean, that must be happening
Mm-hmm.
for them to spread. For them to spread in the body, they must reproduce, like, I'm not sorry for the analogy, for cancer cells.
Yes, yeah, absolutely. Yep. They have Lyme has a monthly cycle of reproduction.
Okay.
Yep. Okay. I don't know if I got to your
So the
question.
spirochetes actually reproduce monthly?
Yes.
And I think, were you asking where the spirochetes go?
Yeah, I would assume they're released into the bloodstream, and then the antibiotic can attack them within a 6-hour. That's why the cycle of the medications.
Which I think is a great question, because actually don't they travel in the collagenous tissue, not just in the bloodstream?
Yes, and so, you know, the less blood flow that gets to an area, the harder it is to get to that area to kill the Lyme. But there are certain herbs or certain antibiotics that do go through the blood-brain barrier, for instance, which is a big concern, or do go into the joint space. So, you know, that's definitely getting into a lot of advanced ideas that I'm going to just, unfortunately, I think for time's sake, we're going to.
Medically prescribed antibiotics as opposed to herbal.
And herbals, they're, and we're going to talk about certain herbs that do that, yes. So after a known tick bite, certainly looking for symptoms is also important. So looking for the bullseye rash, or the bullseye rash that could look otherwise, but a rash around the tick bite. Looking for symptoms like fever, flu-like symptoms, new headaches, new joint pain, new muscle pain. Bell's palsy can also happen at this time, which is a drooping of one side of the face because of a muscle control loss. That can happen at this stage. So looking for those things, that one would be pretty obvious. That can happen over the next 30 days. So tick testing, some people had a question about this. So I do recommend tickreport.com. That's at UMass Amherst. They're amazing and they're collecting so much data. It's wonderful to go on and look at their statistics because any tick that they test, they report on, and you can actually look at the different statistics for ticks and pathogens in any area of the United States. So you can save the tick. It's helpful to put a cotton ball with water in. You don't have to actually, but it'll help keep it alive. They can test dead ticks, but I think it's a little better to have it alive. But they will let you know if they can't test the tick. So some people only get fragments. You could certainly send it anyway, and they will let you know if they can't test it. Yes?
How much does that cost, do you know?
So the first level of testing is $50. And I think that's sufficient for a deer tick. It's covering everything that we know that they actually carry anyway. So I don't think there's any need to go further. But there are two other options that are more expensive. And it's great. They email you results within a week, so you find out pretty quickly. So now let's talk about diagnosis of Lyme and other tick-borne diseases. So we're going to go over these 3 stages of Lyme disease. This is a little bit more of a textbook approach. I don't necessarily see that it happens in this very clean-cut, neat way. But for the sake of discussing it today, I will go through these 3 stages. First, looking at this picture again of the great imitator and just how challenging it can be to have Lyme. So stage 1 would be the acute stage. So within the first 30 days, we discussed already the symptoms to look out for. This would be an acute, which is, a sudden onset of symptoms that last 30 days. So. And stage 2 is when this very classic pattern for Lyme happens, this intermittent, migratory, asymmetric pattern. So it's very traditional in Lyme patients to see that they have a coming and going of symptoms, that it moves around the body. Asymmetry is also apparent sometimes, not always, but that would be a very classic presentation. Possible flu-like symptoms at this stage may continue, and now this is when it might affect certain organs. Stage 3 is when the nervous system becomes affected. Now, meningitis usually happens within the first 30 days, so that's actually more of an acute presentation with stiff neck, pain, headache, fever. Usually people with that kind of symptom go to the ER and get treated, which is great. And other things that can be really challenging. These neurological symptoms can be really awful to experience and hard to treat. So things like numbness and burning and tingling and shooting pains can affect memory, can affect your cranial nerves. So we had talked about Bell's palsy, can affect vision, and can cause mood changes and personality changes. I'd like to take a moment on pediatrics. So the fastest growing population of Lyme is actually boys 5 to 9 years old. So this is really important to think about. Tick checks with kids, doing all the prevention we can with kids. And so it can sometimes present in different ways with children. Also sometimes, depending on the age, it's hard for them to communicate or know that something's wrong and how to describe it, of course. But we do see, if they're really small, developmental delays could actually be Lyme. Of course, there could be other reasons for this, but sometimes it's important to think about, could Lyme actually be a cause for a baby not to go from one stage of crawling to walking to speaking, you know, these different sorts of developmental stages that happen. Also, sensory integration problems happens a lot more in kids than adults. Behavioral problems, and then digestive issues I see more with kids than adults with Lyme. But you know, sometimes, for instance, I've had patients come in, and if it's a child, it might just be that all of a sudden, out of nowhere, they're having tantrums and they don't want to go to soccer anymore, and nothing's really changed in the school environment or the home environment. They're just really tired, they're not getting up, and any sudden shift like that might, upon more questioning, be Lyme. So it's just something to consider. So anaplasma has gone through a lot of changes in nomenclature. So for those who are interested, these are the changes there. Ehrlichia is not found in deer ticks in this area, but that's its cousin, basically. And then so anaplasma is the one that we see. And actually, this is easy to treat. It's refreshing. Doxycycline actually treats it really well. And often people notice that they have this because they have a high fever after a tick bite, and often a headache is a big symptom for people. So it'll bring them to the ER, they'll get their doxycycline, and actually it's enough. So, so out of all the tick-borne diseases to get, this one I think is the best. So Babesia, not so much. So Babesia, although it was first diagnosed in '69, it's taken a long time to get more recognition and more research behind it to understand how it works, how it lives. And so it actually is a protozoa, not a bacteria, so it's treated in a very different way, and that's important to know. So your doxycycline is not going to treat this. So if somebody had Lyme and Babesia and you get some treatment for Lyme, it won't get to the Babesia. So here are some symptoms of Babesia. Again, high fevers, that could bring you to the ER. Palpitations, night sweats, air hunger, and chest pressure. This is a very particular presentation of Babesia that I see in more chronically ill people with Babesia. Yeah, so not on exertion, so it's different from like a shortness of breath going up the stairs. It could be just sitting or lying down. A lot of times, unfortunately, this happens at night for people, which is scary. It could happen with palpitations and night sweats at night, which is even more scary. So it's sort of this just not really getting enough air in that people describe. It's very unique. Headaches are a little bit more of like a pressure type of a headache. And then things like cough, imbalance. Bartonella I do want to spend a moment on because I see a lot of it in more chronically ill folks. This can be tick-borne, but I actually see that it's usually flea-borne. It hasn't been proven yet to be transmitted to a human by a tick. So we're still waiting for that, whether or not that's true. So I see it as a co-infection, which means an infection with Lyme sometimes, but maybe not from the tick. Maybe somebody has a history of flea infestation in the house, dogs or cats with fleas, or they went camping and they had some flea bites. So it's really interesting. Sometimes it's just a totally different infection that someone might be dealing with. So this is called cat scratch fever as well. And so you can get it from a cat scratch. So what happens is in the cat's claws, they can carry the feces of the fleas. So when they scratch themselves, they get the feces in their nail. If they scratch you, they transmit the feces, which carries the Bartonella. Another lovely image, right? So that's if you get a tick, or if you get a cat scratch, and it's pretty inflamed, painful, swelling red, that sort of thing. That's something to think about. If the cat had fleas, could it have transmitted Bartonella? So that's one way that you can get it. You can also get it from the bites from the fleas. So specific symptoms of this disease, there's this interesting pain in the bottom of the feet that can present with Bartonella, and the shins as well, swollen glands. Of course, there can be other reasons for swollen glands, but this is something we see a lot with Bartonella, so in the neck or underarms or groin. And then there's this interesting rash. I've only seen this several times. So they look like stretch marks, but they're usually vertical, and this is actually cultured, so we know it's Bartonella. So it's hard to know, is that a stretch mark or is it Bartonella, but I've seen it a few times more the vertical pattern. It could also be on the back. Yes?
Does that happen in every case?
No. So this is only sometimes. Yeah. I've seen a lot of Bartonella, so pretty uncommon. So now for the deep descent into lab testing. So a little disclaimer. We'll talk about the 2 standards of care. So someone mentioned the idea that, if you don't have the tick attached for 72 hours, you're okay, or the idea of some shorter treatments for Lyme has come up so far. And so all of that is basically the standard of care that's the standard in the United States, guided by the CDC, or IDSA, the Infectious Diseases Society of America. And so they use specific guidelines that generally use testing like the ELISA test, which we will talk about, and recommend shorter courses of antibiotics, just using one antibiotic that would only affect the free form, the spirochete form of Lyme, and that there is no such thing as a chronic infection. So as you may have guessed, I have been trained through ILADS, the International Lyme and Associated Diseases Society, and so they use Burriscano. That was that doctor over across the Sound in Long Island that was seeing kids with Lyme in the 80s. They first were using his guidelines, and now since then, of course, there are many other wonderful pioneers like Dr. Richard Horowitz, who has contributed so much to the field that I trained with and use a lot of his guidelines. So they talk about more accurate testing, that maybe we need to use more than one antibiotic, maybe even herbs, depending on who you are in this organization. Also maybe longer treatments, and that, yes, we see that chronic infection can happen with tick-borne disease. So just to go over the different lab testing options next. So the mainstream standard of care would be to do the ELISA test. So this is looking at antibodies. And if it were positive, if any of these tests we talk about today were positive, it would just mean that at some point your immune system came into contact with Lyme and made antibodies. So it doesn't tell us if you have it now, when you got it, and retesting won't tell us that it's gone. But it's useful to look at testing in general to see if you've ever been exposed to Lyme. So this ELISA test is not very accurate, but it is unfortunately the standard of care out there. It was actually created for surveillance. So when we were talking about these, the incidence of Lyme and all the reported cases, those maps that show how much Lyme is out there, that's why this was created. It wasn't actually created for diagnosis. And this is known and understood, or maybe not understood. This is known by everybody, yet it's used in a diagnostic way, which is, again, unfortunate. So you could do a Western blot. Before jumping into IGeneX, you can actually do a Western blot through a regular lab like Quest or a hospital lab. It's going to be a little more accurate than an ELISA test. It's going to be about 60 to 70% accurate, so that's helpful. So if one has an option between an ELISA and a Western blot at a regular commercial lab, choosing the Western blot is a great idea. For further accuracy, we can turn to IGeneX, which I use, and so they have a Western blot that's even more accurate, so about 70 to 80%, a little bit better. And that's because they use these two bands or antibodies, number 31 and 34, that everybody agrees are Lyme antibodies, and which has been taken out of the commercial Western blot that you can get at a regular hospital. So this increases its accuracy, and so this one is going to be a little bit better of a test. So I talked about these bands. So when you get a Western blot, you get this print off of all these numbers. So these are the numbered antibodies or bands that are Lyme antibodies. So for anyone that wants to know that, if you look at one of those tests, that's what you're looking for. And the way I've been trained and that I look at these tests is if you created any of those antibodies, that means that you've actually come into contact with Lyme and made an immune response. And so that's significant. It is also interesting, one of the theories behind why this is not used in the commercially available Western blot is that the 31 and 34 antibodies were actually used in the vaccine, which to me just further tells us how specific they are and how useful it would be to have them included in that test. The vaccine only lasted about a year or two. Unfortunately, some people got sick with Lyme from it, and for some other reasons, they took it off the market. So it was about 99, 2000 that it was out there. So certainly a very small part of the population was affected by that. So I think it would be useful to just ask somebody if they've had the vaccine and then include these in the testing. IGeneX also offers an immunoblot, which is a little more accurate. So the sensitivity is 90%, which is so much better, and the specificity is 98, which is amazing. So they're also looking beyond Borrelia burgdorferi. So this is a major discussion in the world of Lyme and research in that world, because what we're seeing is, wow, actually there's so many strains of Borrelia. There's so many species, first of all, and strains. So they actually added some other species to the list, as you can see, because maybe not everybody has the strict Borrelia burgdorferi, which was named Lyme because of Lyme, Connecticut, where it came from. But maybe actually people are having all these other Borrelias that can cause the same types of symptoms.
So, same with that one, can you still, if you get a negative test, can you still have one?
Yes, but it's more, 90% is almost, like the gold standard of testing is 95% regarding sensitivity. So this is almost there. It's not quite there, but it's better than everything else. Yes?
Will standard hospitals agree to test for these results or send to that lab if you ask them? Or?
No, I haven't come across that. Anyway, maybe there's somebody out there.
So you have to do it yourself.
Yeah, you have to see, you can ask.
As a provider, you have to do it yourself.
Right, a provider would have an account with IGeneX because it's a private lab. Anyone that wants to do that can. A hospital could choose to do that. I haven't heard of anyone. Maybe someone's out there. But you'd have to set up an account with them. Or the actual, the doctor, the provider would have to set up an account with them. And then send the blood off to them. Yes?
Any idea why the CDC is so slow on this?
No, that's a big question.
I mean, it's right in our face. It's out there like crazy. Tons of people are getting affected by it.
Yeah.
And the CDC is going, well, we don't see very much of it.
Well, one hopeful thing is that there is a task force out of Washington, D.C. Dr. Horowitz is one of its members, so it feels like they're really going to inform some policy. They already have. There have been some beginnings to change because they only started meeting about 1.5 years ago. So if anyone's interested in it, you can look it up online. They actually want public comment, and they have shared, these very, very extensive reports. They're working really hard, and I think something wonderful is going to come from that. So I think there's hope. Yeah.
Does insurance cover the?
So the IGeneX, Medicare is the only insurance that covers it.
So private insurance, you got to pay out of pocket.
Yes, yeah. So other tick-borne diseases, IGeneX is also a better choice if you're looking for Babesia or Bartonella. So since I mentioned those earlier, just wanted to mention that these two are the better options for those tests. It's about 10% accurate doing a test through a regular lab. Pharmaceutical antibiotics. Let's talk about those two standards of care here. So we have this one-time dose that I like to address with what the CDC recommends. And unfortunately, that's only based on one study, and that study is very flawed, and it only shows an 87% effective rate with those who have Erythema migrans that resolve, which would happen anyway. So there are a lot of other points on that, but so I certainly don't recommend doing a one-time or even two-time. Some people do that. Everyone's different, where someone will do a week. Everyone comes in with a different story that people have settled on after a tick bite. Also, in addition to that part, then usually the CDC recommends 30 days, or in neurological Lyme, they do recommend 6 weeks, but I don't usually see that happens when patients come to me after having treatment from another practitioner, but that is under their guidelines. So ILADs generally would recommend more than 30 days of treatment. So moving into my approach, this list could just get longer and longer, but I had to stop somewhere. So these are kind of the biggies to think about in treating Lyme. So we're going to go over antimicrobials, the antibiofilm strategies, detoxification is huge, immune and collagen support, and of course supporting the whole person through this process. So there's quite a spectrum of treatment. There are many pharmaceutical antibiotics that one could use. I do recommend, of course, adding probiotics if using antibiotics 2 hours away from the dose of antibiotics. It prevents things like C. diff, if people have heard about that, this bacteria that can happen. Sometimes that's a little more common in places like hospitals or nursing homes, but it is this watery diarrhea that can happen with antibiotic use that we want to avoid. So I definitely recommend probiotics there. And then certainly thinking about herbals. There are a lot of herbal medicines, some of which we've already talked about, that would be wonderful against Lyme and tick-borne disease. And we can do both. That came up earlier. So yes, I've used deer tick bite formula and doxycycline, or whatever herbs we're using, and some pharmaceutical antibiotics. And of course, targeting all those ways that Lyme exists and hide is hugely important. So this is just some information. There's an extensive list, but there are different ways in which antibiotics work, of course, and so they can get to different ways that Lyme might exist. So there are a couple that we can use for the cyst form, but usually I end up using more herbals or grapefruit seed extract that works to get to the cyst form. And unfortunately, the research shows that antibiotics by themselves don't work very well. So there's a lot of relapse just using an antibiotic. So these are some of my mentors and colleagues. Some of these folks have written books, like I mentioned before, Buhner and Healing Lyme. He also has some co-infection books that are excellent. If you're looking to read more about the herbs, or especially all the research on them, that would be a go-to book. There's some Chinese medicine folks, Klinghardt, Byron White, who has created a line of products that work really well against tick-borne disease. The Cowden protocol that has some research behind it that works very, very well. So speaking of the Cowden protocol, Cemento, Banderol, and more recently stevia of all things, the sweet herb that people use to sweeten things, those were shown to actually kill Lyme in the lab, and most of them better than doxycycline and some other antibiotics that they were looking at. So that was wonderful research to come across. So let's talk about these different herbs in a little more detail. We've got cat's claw, which is also called Cemento in the Cowden protocol, if you know about that. So this is a very popular, very known, well-known and well-researched herb, especially for Lyme. So it kills Lyme. It's also anti-inflammatory. The wonderful thing about herbs is that they do more than one thing. They have a lot of properties, a lot of constituents that work in all these different ways, which is so wonderful. They work with the body. They work with the immune system. So instead of using, or in addition to using, a pharmaceutical that has been engineered to do one thing really well, to use herbs is just such a gift to our bodies. So of course, cat's claw affects our immune system in a certain way that helps us get back on track regarding killing Lyme, or functioning well in the face of Lyme, because Lyme has a very specific way of affecting the immune system that kind of throws it off track. And so this is one of the many herbs that work in this way to help your body kill Lyme. Banderol is also antifungal in addition to Lyme, so that's a nice added bonus with Banderol. Andrographis we talked about earlier that you can use on the tick bite. This is also one that crosses the blood-brain barrier, so that came up earlier, getting to those hard-to-reach places in the body where Lyme loves to go and hide. It also protects the liver and the heart. Japanese knotweed, does anyone have that on their property? So actually with the ticks come Japanese knotweed, a medicine that actually kills Lyme. So it's the root, the hardest part to get, but you could actually make medicine yourself. My herbalist at Sojourns does that with knotweed. And this is also a very highly researched herb. It's amazing for not just Lyme, but many other things like neurological issues. You could just use it, for things like brain fog. It can be really helpful. And of course it has resveratrol in it, so it's wonderful for the heart. It's an amazing antioxidant. So when using resveratrol for Lyme, though, I would recommend using the whole plant of Japanese knotweed because of all the properties it has, opposed to just getting the resveratrol, which is just one property of knotweed, one constituent, one chemical compound. So using the whole plant, you get to use all of the chemical compounds. So this is another one that goes through the blood-brain barrier. And actually this other part, so it also kills Bartonella. Bartonella loves to go into the blood vessels. And so this is very useful in helping with keeping the blood vessels healthy, getting the Bartonella that would go hiding there. So now anti-biofilm. I mentioned serrapeptase earlier, so that is one of the biofilm busters getting through this shell. It's really interesting. There's more and more research coming out of the University of New Haven from Eva Sappi, who I mentioned earlier, and they're looking at the biofilm, and other bacteria, other microorganisms create this around themselves. It's not just the Lyme. And also within one of these biofilms, you might have more than just Lyme. You might have other pathogens, actually. So they're just learning more about this recently. And it's really a very highly sophisticated system, it seems. They have a way of communicating, and once it reaches a certain level of size, they think, they then throw out another little biofilm. And they have these little communities. It's really fascinating. So I think we're going to move into detox, yes. So I'm going to talk about the Jarisch-Herxheimer reaction as we move into talking about detoxification. So we've gone over different strategies to kill Lyme and some of the tick-borne diseases, and now we're going to talk about what can happen when you start this process. So this happens more so in people who may have had Lyme for a longer amount of time. It usually doesn't happen when somebody gets the bullseye rash. You know, you have Lyme, you can treat it easily, which is great. But this worsening of symptoms can happen if you have had Lyme or any tick-borne disease for a period of time. And so what happens is the bacteria release toxins when they're killed, and then those toxins make you feel worse. So there are a lot of things you can do to help yourself through this. But usually this happens the first 2 weeks of the treatment. Also, if you change treatment, like if you're on a longer term treatment and you change from one antibiotic to another or one herbal antibiotic to another, then we're getting to the Lyme in a different way, and you can have that die off again. So really important to be drinking enough water, to be thinking about your liver, your lymph, your kidneys, to help get those toxins out. Or else it can be severe. Some people struggle a lot with this process. So these are some herbs that help with especially liver detox. The red clover, red root, and red sage help a lot with lymph drainage and movement. We don't think about our lymph very much, right? So that's a system unto itself. That's a garbage collector and gets rid of our toxins. So it's important to think about our lymph too. There are things you can do. You can see somebody or learn how to do it. We have this wonderful physical therapist at Sojourns, Evan, who has a specific strategy for lymph drainage and teaches you how to do it. So basically, it's very light touch moving your lymph. So, say, this area we have lymph nodes, and we're going to move that down to your heart, which collects the lymph, and you apply that to your entire body, basically. So that's helping move that lymph to get that garbage out, get those toxins out. Nutrimetics, just to mention some other common herbs used. They have a bunch of detox herbs as well. Byron White. These here, glutathione, the NAC and alpha-lipoic acid are precursors of glutathione. So glutathione we make in our liver, also in our lungs, but for this purpose in our liver, and it is one of the detox pathways. So if we wanted to specifically affect change in the liver in that way, to get that moving better, we can use glutathione, and you can take that orally. I'd recommend a liposomal, which is a fatty carrier of the glutathione that's absorbed better. Or you could do IVs, which we do at Sojourns too, and some people do that and really notice a big difference. So all of these things are different ways to help your detox organs work better. This last list is of binders. So while we're thinking about getting the organs working better, we can also think about binding to toxins in the gut with something like chlorella or bentonite clay. So then it binds to what's there and gets it out through the bowel movement. Some other principles in detoxification would be around diet, so alkalinizing the body. So if we think of acidic food as pro-inflammatory, like the sugar and the alcohol and meat. I'm not against meat, but these are protein by nature is going to be acidic. So those types of things would be more pro-inflammatory, whereas vegetables and certain grains, certain fruits are going to be anti-inflammatory or alkaline. So that's a whole approach that you can look at that's really interesting. There are charts out there, and trying to make choices that are a little more on the alkaline side can really help create an environment that's not friendly to Lyme in your body. Drinking water is so important. Saunas are steam rooms, so thinking about our skin as a detox organ. Forget about that too. So sweating. And some people do better with this than others. So, if you get dizzy and you don't feel well, you don't need to necessarily make yourself do a sauna. But if you do a shorter amount of time, or something like an Epsom salt bath with a little bit of sweating, or if you tolerate it, you can go longer with lots of hydration, maybe electrolytes. It's a great way to get those toxins out. Castor oil packs over the liver, that's another way to detox. Another note on Epsom salt baths, so they're wonderful because it's both magnesium and sulfate. So the magnesium is depleted by Lyme, so that's one of the ways we can absorb magnesium is through the skin. And then the sulfate goes to the sulfation pathway in the liver, another one of these detox pathways. So it's a great thing. Often it's relaxing and might help you go to sleep as well if you do it at night. So now we'll turn to the immune system. So not just focusing on using these agents to kill the Lyme, right, but thinking about our immune system and helping it work better. So there's so many wonderful herbs that can help with these cytokine cascades, as they're called. So there are different chemical messengers in the body that create this inflammation. So this is a list of different herbs. We have something called Lyme Formula 2 at Sojourns, and that has Baikal skullcap, red sage, as well as kudzu and knotweed, and it's a really wonderful immune support as well as a neurological support. Things like fish oil and turmeric, a lot of research behind that showing how anti-inflammatory they are. And also thinking with the fish oil for supporting the brain and all the fat and all of our cell membranes that they need. Next, we have collagen support. So in addition to sugar, yeast, and alcohol, collagen is the food for Lyme. So it loves to, if your joints are affected in Lyme, it loves to use that collagen, and in other places. Certainly like the fascia, if we think about the fascia, which is sort of this encasement around muscles, it loves to go there as well. So thinking about bringing back in the collagen that you've lost. Things like bone broth are wonderful, also lots of wonderful minerals, very nutritious. Gelatin or kudzu root. And then down here we have a list of other joint supports that are very useful that you could do in addition to treatment. So lastly, we have supporting the whole person. It's been quite a journey in helping people treat Lyme, and so many times it's really not straightforward. Everyone is different. It can be a difficult journey, and I see that it's so important to be there, noticing these things, and giving people the feedback that they need to get the support that they need. So a lot of times it can be a lonely journey. People have shared that people just don't get it unless don't understand it, unless they've experienced it, and that it's hard to communicate with loved ones about how difficult it can be. So getting that social support, that family support, support at work, family, school, it can be quite challenging, and so that's a big piece, I think, of supporting the whole person. It can also be, people have shared how much of a spiritual journey, an emotional journey this can be for them. So having space for that is really important. I've seen that Lyme has been the teacher of a lot of folks. People come in miserable, and then I've had people actually say things like, I'm so glad I had Lyme because it changed my life in a really positive way, which I could have never believed when they first came in, and they could have never imagined. So things also like diet that we talked about, hydration, are you getting enough sleep? That's when we have a huge lymph dump from our brains. lymph system. So there's a lot of more recent research on that, just showing how important that deep sleep is, because that's when we have a lot of detox in the brain, basically. So if you're not getting restorative sleep, that's certainly really important, because that's where a lot of healing happens. Stress is huge, especially in addition. Stress is huge anyway for most people. But then you have Lyme on top of it, and you might be trying to have a family or work or go to school. And so I'm thinking about ways to cope with stress. And also investigating so many other things. There can be so many other medical conditions going on in addition to Lyme or tick-borne disease. So really stepping back and seeing the whole picture and trying to take a holistic approach, not missing anything, and not getting too narrowly focused on just Lyme disease is certainly important. So tick checks every night, right? You've all seen the ticks on the bagels? Have you found them? And then I do have this ebook next year. I will have a paperback book. I'm working with a publisher right now, so that's exciting. It'll be 3 or 4 times the length of this. But all the prevention information is in this book, not the information on treatment. Like my approach is not in this. But basically the information on the handout, plus a little bit more about preventing tick bites if anyone is interested. All right. Well, any questions? I'm here at Sojourns down in Westminster, and you can get things like tick bite formula or tick twisters if anybody wanted to go down there. I just say that because people ask me, so yes, you can go do that. You don't have to be a patient. Thank you so much. Any questions?
A lot of information.
Actually, I do. I had an interesting conversation with a couple of people that I knew who grew up in the South.
Mm-hmm.
And ticks are no big deal to them. They go through tick checks every night with their kids. I mean, it's just something they grew up with. Why aren't we seeing Lyme disease in the South?
Well, I think they are. Yeah, it's very underreported down there. But there are certainly ticks that don't transmit, like up here, the dog ticks. Don't transmit disease. So, you know, it's very oriented to which state you're in, you know, what the landscape's like, which ticks are there, and whether or not they actually transmit. So yeah, so I don't know enough about where they're from and what ticks they have, but yeah, Lone Star ticks are big in the South. They transmit something called star eye, which is, I really think that's going to be the next big thing, that's a Lyme-like illness. They have not identified, or there's a big argument actually over, they think they identified Borrelia lone stari, but then there's this huge debate over whether or not it actually exists. I can't really understand what's going on in the literature there. So I'm really looking forward to, I think the next 10 or 20 years, we're going to learn a lot more about star eye. So it's basically a Lyme-like illness. You know, if it's Borrelia, it's just like the other Borrelia. It's just like Lyme. So people get flu-like symptoms. You can get a rash with star eye. So I wonder if it's just very underreported, unfortunately. I bet a lot of people are actually affected by it. Yeah. So they may not have Borrelia burgdorferi as much as we do, but I bet they have whatever's causing this star eye more so. And of course there's Ehrlichia and tularemia. I mean, there's, you know, a little bit more of those types of tick-borne diseases down there than up here, you know.
It just seems like so much to absorb.
Yes, that's a lot of information.
Yes. Thank you so much.
Thank you. Thank you
for coming. And if anyone would like to sign up for the library online newsletter, there's a little sheet back there you can sign up, and we're just really glad that you came tonight. Thank you.
Yeah, take handouts if you didn't get one, or cards if you want, anything back there. Yeah.